A new therapy, 177Lu-PSMA-I&T, is being investigated in patients with metastatic castration-resistant prostate cancer. In these patients, the cancer has spread outside of the prostate. There are two most commonly used methods to administer the therapy: the gravity method and the gravity method with an infusion pump. To start, prepare the vial, consistent with standard site procedures. Expose the top of the vial, swab with a sterile alcohol wipe, and allow to dry. Insert an IV line, flush with saline, and introduce the long needle to the bottom of the vial. The needle should be inserted at a 45 to 60 degree angle, with the bevel up. A small amount of pressure is applied, and the angle is gradually increased as the needle is inserted into the vial. Flush a second IV line attached to a short needle with saline and insert into the vial. The needles must not come into contact. The short needle must stay above the liquid therapy. Allow saline to flow or be pumped into the vial at a rate consistent with site procedures. Infuse the medication at a rate per your site guidelines. Infusion time will be dependent on the rate selected. Monitor the needles to ensure they never touch each other and the short needle never touches the therapy. Ensure that the level of the solution in the vial remains constant, does not start getting close to the septum, and is not at risk of being empty. Measure levels of radioactivity. The therapy should be fully administered as the reading remains stable, no longer declining. Before removing the needles from the vial, stop the infusion. The total administration time is dependent on the rate of infusion. To verify this, measure for post-dose activity. Dispose of the therapy and discharge the patient as per site guidelines.